When I was in medical school, I never heard the word palliative care and heard nothing about end of life, and you would have thought that nobody died of all the diseases that I was learning about. Palliative care is care for people with life-threatening illness that focuses on improving quality of life. It focuses on pain control, on relieving symptoms, but also on providing support. A large percentage of them will not come back to the hospital. We work as a team that includes a doctor, nurse, social worker, chaplain. We talk to patients to say, like, what's important to you? And let's make sure the treatment supports those things that are important to you. I remember when I was an intern taking care of a young woman with leukemia. She was about 22 years old. She had a 2-year-old daughter. I was just at the beginning of my training, but I could see that we were going nowhere and she was going to die. What was so striking is the rest of the team, including my attending physician, did not acknowledge that at all. Maybe she doesn't want to be in our hospital. Maybe she'd rather be home in her own bed, reading a book to her 2-year-old. We didn't give her the choice. I thought, there has to be a better way than this to take care of people.
Yeah, but it has nothing to do with my disease.
I think it's human and natural for us to not want to talk about death. I think for physicians, it probably goes one step further, that we have traditionally viewed it as a failure. And so that's why it's taken real leadership to put it on the radar screen.
We are the only palliative care leadership center in California. We have been working with teams from hospitals to help them develop palliative care services so that they can serve their patients. A recent study shows that people tend to live 25% longer if they get palliative care from the day of diagnosis. We also know that they're less likely to end up in an intensive care unit, and they're less likely to get chemotherapy in the month before they die, where it's shown not to be effective.
This is one of those areas where doing the right thing is also doing the more cost-effective thing.
If palliative care was in a pill, everybody would demand it, and the stock price would have gone through the roof. But it's not that. It's a team taking care of patients together so we can really provide holistic care.